Hey there VCE HHD students, my name's Andy, I'm a VCE Health and Human Development teacher. In this short video we're going to look at answering the 2021 VCE HHD exam question number 3. Before we dive into question number 3, just a reminder over at the Health Resources Hub YouTube channel, a new video like this one is coming out each day between now and the HHD exam this year. You can subscribe with the button in the bottom corner of the video there. Please let your HHD friends know they can do so too to get access to all those videos. There's one more aced HHD exam preparation session that I'm running, and that's coming up next week. And you can book a spot to that at book.acedvc.com. You can see our social media links there if you'd like to follow us and get alerts to all of the new videos coming out each day, and also our email. Okay, so you can see here this question was worth 8 marks in the 2021 exam. And so there was some stimulus material there regarding 4 in 10 people were aged over 65 and said they were excellent and very good health in Australia. And it was estimated that 400,000 to 459,000 Australians were living with dementia, but that number was expected to increase between 550,000 and 590,000 by 2030, in line with continued growth and aging of Australia's population. And so A was asking for 2 marks, what's the difference between self-assessed health status and morbidity? So this is really just one of those sort of definitions or description type questions. So you can see down the bottom there, you could have said something like self-assessed health status is a measure of one's health that's influenced and based on an individual's own perception of their health, whereas morbidity relates to levels of ill health in individual or population. So that question was answered relatively well. Now you can see here B was worth 6 marks, and this asked you to use the information to discuss the implications of increasing life expectancy for Australia's health system. So in the information provided, it talked about a rising number of individuals experiencing dementia. And so in relation to Australia's health system, that's probably going to have a significant effect on the ability to continue to provide services to all Australians and the sustainability of the healthcare system. And so you'll see the examiner's report says this question was not answered well, and that even though no positive implications were evident in the information, it was possible for students to make some positive links. But if you only made positive links, okay, you were seen to be neglecting key information in the stimulus and you weren't able to achieve full marks. So you can see there they've given you an example of a high scoring response. And so one of the things to really think about if you see a question that mentions the Australian health system is trying to link into things like Medicare, PBS, NDIS, or private health insurance. And so this student did a good job of that. They linked into the fact that dementia, okay, is likely to have an impact on the healthcare system. So they talked about how the PBS might experience an increase in demand for medications related to dementia, and there might be an increased burden on Medicare, okay, and therefore the Medicare levy and Medicare levy surcharge might have to rise, which might have an impact on people's access to healthcare and also equity. So have a read of that high scoring response and think about if you were given that question, could you go through and make sort of, I would say 3 clear links for sort of 2 marks each on how an increase in life expectancy could impact on different aspects of the healthcare system, because it's quite a challenging question, as you can see from the number of students that were able to achieve full marks in 2021. Okay, hopefully you found that video useful. Just a reminder, the Health Resources Hub YouTube channel is there, the aced HHD exam preparation session, our social media links, and our email. Thanks so much.